Are you getting me?
Okay, this is Kimberly Newcombe's speech and her audience, including the cameraman, me. And here she is.
How many of you have experienced change in bowel habits, like maybe a little bit of diarrhea, bleeding, lower abdominal pain? Show of hands. Okay, a few of you. All right, chances are that if you had those symptoms, your body could be telling you that you may possibly have a colon polyp or colon cancer developing in your colon. After hearing my speech today, you will be able to recognize that the most effective way to reduce your risk for colon cancer and colon polyps is by having a regular colon cancer screening. The American Cancer Society, who has been devoted for over 100 years to battling cancer, saving lives, developing guidelines for cancer screenings, has released an article in February of 2010 stating that the most effective way to reduce your risks for colon cancer and prevent colon polyps from turning into colon cancer is by having regular colon cancer screenings. The USA Today newspaper also published an article just today on July the 6th of 2011 which stated the CDC reported that the number of colon cancer cases being reported has been reduced by 66,000 between the years of 2003 and 2007, and that the number of deaths by colon cancer has reduced by 32,000. And this has simply been prevented by regular colon cancer screenings. I am also an advocate of colon cancer screening because I've worked for a gastroenterologist group for the last 9.5 years, which has a doctor base of 11 physicians. I assist the doctors with colon cancer screenings by assisting with colonoscopies. We remove polyps, we biopsy cancers in the colon, and I get to bear witness to lives that have been saved just from simple screening. These patients have had polyps in their colon and they've experienced no signs or symptoms whatsoever. As I proceed through my speech, I'm going to explain to you and show you what a colon polyp is, what colon cancer is. I'm also going to describe risk factors that are involved with colon polyps and colon cancer and some warning signs. And then I'm also going to give you some recommendations for anyone over the age of 50 for regular colon cancer screenings and what tests involve in those screenings. First, I'm going to tell you about what a colon polyp is. A colon polyp is an abnormal growth of the inner wall of the colon. It just grows over time and it can turn into colon cancer. They can vary in size and shape. They can vary in how fast they grow. This is an example of a small colon polyp that has grown in the wall of the colon. This is an example of a larger colon polyp that has grown over time, has developed larger in the colon. Colon cancer is basically fast-growing cells that are malignant and they have invaded the nearby tissue. They can also become metastatic. It can invade other parts of the body. Once it starts developing, it can be fast-growing and it can cause the tissue to look necrotic, which is basically like a black and dead area. And this is an example of colon cancer in the colon. It has invaded the wall of the colon. Now that I've shown you what a colon polyp and colon cancer looks like, I'm going to give you some examples of risk factors for colon cancer and colon polyps and some warning signs that you might be able to notice one day if you have colon cancer. Some risk factors are anyone over the age of 50 is at risk for developing colon polyps and colon cancer. Anyone who has family history, like your mother, your father, your brother, your sister, your aunts, uncles, anyone who has a family history of colon cancer and colon polyps are at a higher risk for developing colon cancer and colon polyps themselves. Anyone who has inflammatory bowel disease such as ulcerative colitis, Crohn's disease has a higher risk of developing colon cancer and colon polyps. Some warning signs that may alert you that you may have a problem of colon cancer going on in your body is that you may have bleeding, you may have a change in bowel habits like diarrhea, and you may experience lower abdominal pain. Now that I've given you some risk factors and some warning signs, I'm going to give you some examples of how regular colon screenings are done, based on your risk factors. For anyone who is over the age of 50 and has no symptoms and is at a lower risk factor, the first thing that the American Cancer Society and the CDC recommends is that you do a 3-day Hemocult card once a year. Now that's basically where you've taken stool samples and you've put them on a card, and the doctor will view them to see if you have blood in your stool. If you have blood in your stool, then he will continue your colon cancer surveillance further. It is also recommended that you have a sigmoidoscopy every 5 years. That's basically where they take a light-guided tube up into the shorter distance in your colon, just surveillancing for colon cancer and colon polyps. They also recommend that every 10 years you have a colonoscopy, and that is where they take a light-guided tube and they go the full length of your colon all the way to your cecum, surveillancing for colon cancer and colon polyps. In conclusion, now that I have given you some warning signs and some symptoms, risk factors, this is hopefully going to help you reduce your chances of developing colon cancer and colon polyps. Most of the colon polyps that our physicians have removed in our office, 25% of the precancerous polyps that were removed were the patient was experiencing no warning signs whatsoever. So the next time your doctor recommends to you that you have a cancer screening, you might want to consider that having that screening test could possibly save your life. Thank you.